St. Joseph's is proud of some recent accomplishments in care and service that I would like to share with you. On June the 14th, we celebrated the opening of the Southwest Centre for Forensic Mental Health Care in Central Elgin. We were delighted that the community came to see that new building. We celebrated the opening with dignitaries. That day, over 1,000 people went through that new building. Our patients have since moved into that building and are settling into new surroundings. The building is infused with natural light. About 75% of the building is lit through natural light. There are secure outdoor spaces that allow people to enjoy the trees and the environment. We are also delighted that it provides dignified space with private rooms, recreational spaces to allow us to focus on recovery and restoration for the patients that we serve within that building. I would also like to acknowledge the incredible hard work of our leaders and the staff in the Forensic Mental Health Program as they transition patients into that new building and have assisted them to settle into these new surroundings. Across St. Joseph's, we are focusing on the integration of care to better serve the people of this community and region. We have a responsibility to provide care to people living with chronic diseases, and with the number of programs we have at St. Joseph's Hospital, we are working to provide more integrated care. For example, we have just piloted a new process where people with type 1 diabetes will see all their caregivers on the same day to minimize the amount of travel time. We have integrated our pituitary team so that they will see their patients in one day through an itinerary of care to allow an integrated care plan for our patients living with that disease. Our endocrinology program is working with our ophthalmology program to provide better screening and care for those living with diabetes. Our endoscopy suite and our CT suite are working together so that people who have a problem completing the endoscopy because of risk can have a virtual colonoscopy under the same preparation. And if any of you have had that preparation, you know that one is enough. Our staff continue to focus on providing integrated care to minimize the travel time and the inconvenience for our patients who are coming locally or from afar, and to saving people vacation days so they don't have to spend their time in the hospital seeing doctors rather they're on vacation with their families. I'm pleased to report that we continue to see gains in quality, patient safety and access. In 2009-10, 90% of cancer surgeries were completed within 126 days. Today, 90% of cancer surgeries are completed within 55 days, 29 days less than the target that was set for this year. In 2010, the wait time was 16 weeks from the time of an abnormal mammogram to surgery. In the fourth quarter of this year, the wait time had been cut to 8 weeks. We know that waiting is a time of incredible anxiety for our patients, both men and women, who receive care in our breast care program. We will continue to try and reduce this wait time as much as possible within the capacity of the resources that we have. Regretfully, we have seen the wait times grow in cataract surgery and MRI. The volumes that we were funded for have been reduced this past year, and as a result, we are seeing, because of the continued and increasing demand for cataract surgery and MRI, we are seeing an increase in our wait time for cataract and MRI. Our staff and leaders are committed to, within the resources that we are funded, to make sure that we continue to strive to keep the wait time as low as possible within those resources. On June the 13th, we had our annual meeting at St. Joseph's Healthcare London, and as usual, we have created an annual report to the community. This year, the annual report is posted online, and you can go to the website of St. Joseph's Healthcare London and see the annual report. It includes patient stories, it includes our patient safety and quality results, and it includes our financial results. We hope that you will look there to find more information about our accomplishments through the last fiscal year. As always, I welcome your feedback. I receive letters and I receive feedback through our internet site, and I am delighted when I hear from the community about the care they have been provided. Our vision statement says that we will earn complete confidence in the care we provide. And many of you have written to say that we have earned your complete confidence, and you've told me why. Some of you have written to say that we didn't, and we are striving to improve the care that we provide thanks to your feedback. So as always, I welcome your feedback. Thank you.